Welcome to Real Herbalism Radio, show 211, recorded at River Road Studios in Eugene, Oregon. Today's show was made possible by support from the Herbal Nerd Society. To join the Herbal Nerd Society, just go to thepracticalherbalist.com, click on the join link in the upper menu, and learn more about that. Today's show is an Herb Lab show about Justin Ehrlich, and he's an acupuncturist and Chinese medicine practitioner we had in. On healing and self-transformation through the natural world. So, without further ado, here are your hosts, Candace Hunter and Patrick Hunter.
I'm Candace Hunter.
I'm Patrick Hunter.
And welcome to Real Herbalism Radio. Okay, eventually we'll get that down.
I'm actually looking at you for the voice cues. And it's so funny because in my head I know what to say, but I can't say it.
I know exactly how you feel.
I can't say it. So today's show is all about Justin, and we have a couple of little things like herbs in the news, which we haven't had in a while, but there was one that caught my eye, and I thought, wow, we should talk about this one. Mm-hmm. Yes. Do you have some things to say about Mr. Ehrlich?
Oh, I enjoy talking with him. He has such a grounding presence, and he knows so much about herbs and plants and healing.
As a sound mixer guy here in our podcast, it was funny because oftentimes when we're listening to people, I have to kind of monitor their ups and downs.
Yeah.
And he was just
He's
straight across the line.
Even keel. Yeah.
Even when we had a snafu happen where we lost connection, it was almost like he didn't break his Zen-like quality.
Right. Yeah. It's kind of refreshing, actually.
So it was
with all the crazy in the world, or at least in my world, it's nice to have somebody who's just even keel.
Right.
So yeah, I enjoy talking with Justin a lot. I admit that at the time when we were interviewing him, I did not have access to red peony root, but I have since procured some.
And why was it so big for you to do that after you talked with him?
Well, I've had access to white peony root. So I'm not an acupuncturist. I do not have a license in that, which means that for me, getting a hold of Chinese herbs is really difficult.
Okay.
In American herbal practice or medicine practice, however you want to call it, the people who provide, or the companies that provide Chinese herbs to practitioners often require you to have an acupuncturist license before they'll sell to you. Mm-hmm. Part of that is because Chinese herbal medicine encompasses a very large number of plants and other substances, and they don't want to lose any of their pharmacology. They don't want to lose any parts of their herbs to government regulation. And they have lost some due to Western people using them inappropriately.
Like a Ephedra, right?
Yeah, like Ephedra is one. Ephedra is a really powerful and very helpful decongestant, I guess, is what, as a Western medicine person, you might call it. It works on the sinuses and it opens up the sinuses. It's also been helpful and been used for things like conditions like asthma. Mm-hmm. In Western medicine, there's an awful lot of money in developing pharmacology for all of those different things, those conditions. And there's a lot of regulation over those drugs as well as other drugs the pharmaceutical industry does. Right. So ephedra, at one point, I don't remember, it was like 20 or 30 years ago, someone somewhere decided to start marketing it or using it or talking about using it for weight loss. And it became a thing. And anyone who's familiar with American mainstream culture, things become things. Like turmeric became this huge thing for a while a couple of years ago, to the point where someone somewhere decided to start giving people IVs with turmeric extract in them. Mm-hmm. So we in the West here do some things that I personally say are a little bit crazy, but we do them. And when we do them and it leads to someone being seriously injured or killed, and the pharmaceutical industry finds that they don't like that as well, the two come together, the government might step in and say, okay, well, now this plant is no longer accessible. Like marijuana suddenly was no longer accessible 100 years ago. Now it's coming back. Ephedra has gone through the same thing. And so Chinese medicine practitioners have to have a license, an acupuncturist license, because that's what's licensed in America, to be able to buy Chinese herbs. Other sellers sell some Chinese herbs. Like, for instance, I've been able to get white peony root and danshen, or red sage root, through Mountain Rose Herbs. It's not always in stock. Sometimes it is, sometimes it isn't. But I can get it. Mm-hmm. And I don't know for sure how they specifically source their Chinese herbs that they sell, the handful they sell. Mm-hmm. But I do know Mountain Rose Herbs is a really strongly ethical company, and et cetera, et cetera. I'm not going to sit here. But, I trust them to make good choices. So I trust the Chinese herbs I can get through them. But red peony root is not one that I've been able to get through them. I have recently, though, been able to acquire, shall we say, a collection of herbal granules from someone that I know who's an acupuncturist in the area, had been doing some formulation with single herbs and decided that it just wasn't something that her clientele were interested in. And so I bought the rest of what she had, and that included red peony root. And so I had a chance to do just the tiniest amount of just experimenting with it. And I cannot say that at the 2 doses that I've tried myself so far that I notice a clear difference. I know energetically I can feel the difference, but I can't tell you what symptoms have changed or anything. Mm-hmm. But it was one of the ones that I found interesting, because white peony root is one that I've used because I had access, and I've used it oftentimes for when I'm talking with, for the most part, it's been women. It's not to say that men couldn't use it, but for the most part, it's been women. And when I notice they have what seems like a deficiency, there's a weakness to their system, like they're having digestive issues, they're having insomnia, they're having things that have other symptoms that suggest deficiency, but they also are having stagnation, or their energy isn't moving the way it needs to move. And especially when I'm noticing they're having irritability and anger types of symptoms, or emotional mm-hmm. stuff. And then I might see other things that are obvious liver. Chinese system call it liver, liver heat or liver issues, or stagnation in the liver. Mm-hmm. I see other things that kind of indicate that as a possibility. In Western medicine, we would use dandelion root. Mm-hmm. But dandelion root is really draining. And if you're already in a weakened state, then draining away your energy is not going to help you. That's going to make it worse. Right. So white peony root is more circulating than draining. Red peony root has more of a downward draining, or just bringing the energy down. White peony root kind of just lets it go where it's at, but keeps circulating. So I've used it for that and found it really helpful and effective. And I've also found that it has helped lighten the spirits and give the people that I've used it with, it's part of formulas that help bring energy back without using ginsengs and other stimulants and things that people call adaptogens in Western medicine. Mm-hmm. But really, they do help your body adapt, but if you're in a deficiency state, they drain it more. Okay. They exhaust it. So what I've worked with is people who are in that deficiency state. And I've experienced that myself. Right. That's part of why I like working with people there, because I understand what they're going through. And I also understand why, a ginseng or a luthro or even Cotinopsis can be too much. And I understand what that feels like when that's really too much. So anyway, I found it interesting that he was mentioning both red and white peony. And red peony can be a little challenging to get a hold of, although it's not that hard to grow it in your own yard. It's just a matter of knowing how long to grow it before mm-hmm. you dig it up. Right. So anyway, that's my long diatribe on peony. I happen to really I fell in love with white peony a couple of years ago, and because I was able to use it, and yeah.
So one of the things that you had talked about liking was the natural approach, or the natural world. And not just the healing the sickness, but healing the patient.
He said Chinese medicine is really adept at using the emotional to heal the physical, and the physical to heal the emotional, and the emotional to heal the spiritual, et cetera, et cetera. And I really like that. That's one of the pieces of Chinese medicine I truly appreciate, is that if you go to see a Chinese medicine practitioner, they're going to do what your favorite word. They're going to practice holistically.
Oh, you said it. Oh.
They're going to look at your whole life. They're going to look at you as a whole person, and then look at how they can help you. Your treatment will be, if you go to an acupuncturist, your treatment's going to be physical. There will be probably acupuncture, which is needles going into pressure points or acupuncture points. But you can treat depression, you can treat mental illness, you can treat a lot of mental health conditions with that physical act. Or it might be cupping, or it might be moxa. I mean, the breadth of what they can do beyond herbs, and herbs included, it treats both the mental, emotional, and it treats the physical.
Right.
So I appreciate that a lot.
In your practice that you do now, that's how you approach everything too, isn't it?
Yeah.
And you really resonated with him. I mean,
I did.
Sometimes we'll get some interviews, and it's not that you don't care or that you don't. I mean, you do care, and you do want to learn, and you're respectful of everything. But I could always see when you're just in simpatico with people versus when you're not, or versus it's just interesting watching you. And when you were talking with Justin, it was almost like I don't think there was a thing he said that you didn't necessarily agree with him on.
Right. Yeah, so far, we talked a few shows ago, a month ago now, we talked about goals and changes and transformation, all that stuff. And I wasn't expecting when I first met Jimmy Betts, our first show we ran this year, I wasn't expecting when I first met him to be in sync with him at all, but I figured I'd enjoy the conversation.
Right.
And I was more in sync with him than I expected, and it was really fun, and I enjoyed the second show we did with him as well. And when I met Justin for the first time, honestly, I have to admit, I was truly expecting to be more in sync with him because I've taken a look at his website and, I've read a little bit about what he's done, and I've listened to some other podcasts he's done. And yeah, I expected, but he has a way of pulling out information and languaging it that I think is really powerful and speaks to the depth of what plants as well as, other modalities can get to. You know, how by you have a problem like anxiety, and we just listened to that Patriot Act.
Yes.
It's
on Netflix.
The name of the guy, Hassan Minhaj. We just listened to him talking about, he was talking, I'm late on my Patriot Act.
Yes, we do wait for the whole season to be on, and then we watch him.
So it was probably technically last year's.
It was in November, yes.
Yeah. but we just watched, and he was talking about mental health and the insurance industry and how hard it is to get help for mental health.
Even though it's not supposed to be now because of the parity law, there just is.
Yeah. Exactly. So, but when I listened to Justin talking, I'm like, I realized that sometimes to get the help you need, to get the help you need for your anxiety, you can't go straight at it and go to a practitioner and get your therapist and get it covered. Insurance gets in your way, trying to find a therapist, lots of things can get in your way. But sometimes you can go sideways to get to it. So you treat the physical, like you go in to see your acupuncturist or an acupuncturist. Maybe you go in because you're having heart palpitations or you're having stomach aches. Both of those things can occur with anxiety super easily. So you go in for that, or you're having headaches. Those are physical things, and the health insurance industry will be more likely to cover them if acupuncture is covered. And you can get the depression or the anxiety treated at the same time. Whereas if you go to your doctor, you don't really get those two things treated at the same time. Your doctor may give you some anti-anxiety drugs and some painkillers, but they won't be really treating the root of the problem. Whereas your acupuncturist is going to they'll give you some herbs and they'll do some acupuncture, and they're really treating the root of the problem, which is manifesting as both, these headaches or the stomach aches or whatever, and anxiety. Mm-hmm. So anyway, that was this is like big spaghetti I just gave you.
Well, it made me think about our own challenges with mental health with our son and what we had to do to get it to such a point where it was going to be, well, covered. I mean, we would have paid out of pocket as necessary because that's what we would have done, but it gets exceedingly expensive when a 1 hour appointment is $200.
Right. Yes. And a 1 hour appointment with your acupuncturist is going to be more like
50 or 60.
50, maybe 100, depending on where you're living.
Exactly.
But,
in our state, Oregon is actually pretty good about mental health coverage. They make a big point of that. But just like anything else, not every care provider provides it, and not everybody's taking new patients, or they're not covering using that insurance. There's a lot of different things. And anyone that is suffering through those issues, it's not only are you already dealing with those issues, but then you have to walk into this minefield of trying to get treatment, and then it just exacerbates the problem. So it's just crappy. And one of the things that, and this is in my soapbox, that they pointed out on the Patriot Act is, and we encountered this just recently ourselves, Candace, was, you go to a primary care provider, you talk to them, they say, yeah, I believe, you should, use this treatment. Yeah, acupuncture would help, or massage, or whatever it is for your ailment. So you go to the doctor who is certified, has gone through the medical thing, has the job, all that stuff. And then the insurance company gets it, and then they shove it to their doctor who's never met you.
We presume they shove it to a doctor. We don't actually know.
Well, assuming that they do, but it comes back and it gets judged not medically necessary. Okay, so my doctor says it is, and you're supposed to trust my doctor because you tell me that you trust him. And then you have a doctor on your staff, or you've hired
somebody on your staff
that has a vested interest in not providing you care, so the insurance company makes more money.
Right. I don't see how they can have a doctor.
That system should not exist.
Right.
That is counterproductive to the idea that you should have health care.
So why is there even a primary care physician? The primary care physician actually is the insurance company's guy in their back office. That's their actual...
because they're going to deny you coverage because it's not medically necessary, even though your physician said so.
Yeah.
And that's where all of this, whether it's mental health, which it's most prevalent, but even on other things, we've encountered it too, where they'll cover one thing or they'll say the other thing isn't medically necessary, but you're like, well, wait a second. In conjunction, these two things work really well for me because one facilitates the other, and then I'm able to move on and do my things, which is keeping me from spending a whole lot more money on other things that you want me to not spend money on for my health care. So it's frustrating. So that's my soapbox is I think insurance companies need to get their butts out of being primary care providers because that's what they're doing.
That is what they're doing.
They're
it's
being the ones to say what gets done or not.
If you know the right keywords to say to your doctor, who can then put them in a chart and then really give that chart or that information to the insurance company, you may get what you want.
Right. So it's
but
like
it's
a
not
keyword
about
search.
It is exactly like a keyword search. You have to know what the right keywords are that will trigger your insurance company to pay for the treatment you want, rather than going into your doctor and saying, I've got this problem and here's what it is, and letting your doctor figure out what to do and then recommend, and then letting you listen to the recommendations, listen to the information on all the side effects and all the other stuff that comes with it, and make a choice.
Right. So if you want to see that episode, I would recommend watching it, especially the part about the insurance companies losing lawsuit after lawsuit after lawsuit because they are not providing the care that they're supposed to.
And the biggest piece of advice that he gives is if you get denied by your insurance company for the words "it's not medically necessary" or anything like that, complain.
Loudly complain. He said because in their thing, the study they did is about 40% of the people end up getting their coverage that they need if they're vocal and bitchy about it.
Yeah.
So in this case, I guess it does pay to be bitchy about it.
Yeah, and I would say that it might be helpful if you want to try Chinese medicine, herbal or other. You might want to complain loudly if your insurance company denies you.
Mm-hmm. Mm-hmm. All right. One of the other things we used to talk about a lot was herbs in the news.
Ah, yes.
And
you found a really good article.
Yeah,
Interesting.
I have a lot of different feeds coming in. I read a lot of news and information. I should not be doing it as much, but I do. And one that really struck me was there was a question that appeared in my feed, and it said, which is more dangerous, kratom or nutmeg? And I thought it was timely because I've had friends of mine talk about wanting to use nutmeg for hallucinogenic effect. and I've had other friends who used Kratom and also used it to the point of becoming addicted to it. So I thought, well, this is something we should address. So, which is more dangerous? What do you think, Candace?
Well, the premise of the article was that the CDC did a study on the calls that they had coming in over the last 18 years or something like that, and they ranked the number of calls that were related to various different
right. So from 2000 to
substances.
2017, poison control calls.
Yeah, poison control calls. And so the substances, they made a list of what they got calls on the most, next most, and all of that. I think cannabis was at the top of the list.
Marijuana's number one.
And that one's gone up a lot. And their focus was really on people who are not legally adults. They grouped it into a bunch of different age groups, under 6 to 12, and 13 to 19 years of age, and then 19 and above. And what they're finding in their study, the point of the study was really to note that the number of calls coming in regarding those who are not adults, younger than 19, has gone up considerably. And I think they noted that cannabis in particular has gone up considerably.
Right. Well, Kratom on its own, has a massive spike, like 5,000% in 6 years. Well, if you look in the last 6 years, it's become an herb that's available in many places, in many different ways.
Like ephedra, Kratom is really at the mainstream now, and mainstreamers are using it. And there's an idea out there, as there is with quite a few other plants, that it's not addictive and that it's not going to hurt you in any way.
Right.
And that's not a reality.
No.
In regard to most of these various plants, the more potent the medicine, the more capacity the medicine has to cause problems for you if you are using it to excess. Kratom is like marijuana and like many, many other things. You use too much of it, you can become addicted. And you can cause problems for yourself.
Right, and I have actually seen that firsthand. Knowing somebody that's done that.
Yeah.
The interesting part is that I know other people that have used Kratom for mild pain.
Yeah.
Reducing anxiety and a few other things, and they're totally fine, no problem. Because they use it as
they treat it like a medicine,
like a medicine, like an herb that they want to, not a means to an end.
Right. Yeah.
They're not using it to escape reality. They're not using it to, have a opioidic effect for their whole life. They just need it to do this one or two things, and I think that's just fine. I mean, same thing with nutmeg. I use it on my eggnog, but I'm not going to grind 4, 5, 6, 8 nutmegs in a powder and then drink it and hope I'm going to start seeing things.
Right, but because someone somewhere decided to call out the fact that it can do that, and yes, it can, and yes, we've known about that for at least a couple of centuries. I mean,
they used to use it in medieval times for those types of things.
Yeah, it's been around for a long time as something that one can do that with. But
like there's a thread on Reddit as well that even most of the people that have tried it are looking to use it for the hallucinogenic effect. They come to realize that they need so much of it, and by the time they've induced that much quantity of it, they're tired, they're sleepy, they're nauseated. It's nothing.
Yeah, it's not a very pleasant experience.
No, I mean it's not. It's not like psilocybin, the Brahma mushrooms, where you don't need much for that.
Right.
And you're going to have your effect. That's also why they're class 1 at this point. I think still right. So when you boil it down, the real question to be answered is which is more dangerous, right?
Right.
Well, and even in this article, if you read all the stats, you read all the numbers.
Nutmeg actually comes in as being more dangerous than Kratom.
Yet neither of them are really that dangerous at all unless abused
you abuse them.
Like anything else. You abuse alcohol, it's dangerous. You abuse marijuana, it's dangerous. You abuse nutmeg, dangerous.
Yeah.
Kratom, same thing. If you are the type of person that is only looking to find one possible outcome from that herb, that's going to be the abuse.
I mean, truthfully, you shouldn't be leaving any of these types of substances laying around where your kids can just be ingesting.
Well, yeah, I mean, regardless, obviously with children ingesting it is a problem, but they were, for kids.
But it's also a problem if they ingest, laundry detergent.
Well, the calls for for kids under 18, hand sanitizer.
Yeah.
Laundry detergent packets are the number one calls they get. They don't get they don't appear for nutmeg.
And we've been making those things smell like candy for years.
Oh, well, and the Tide Pods look like candy.
And they look like candy.
I mean.
So I found it interesting that the article was there. I can say that nutmeg is not an enjoyable high.
No, I like it on my eggnog, and I like it on certain things here as a flavor enhancer. Mm-hmm. But I do not like it.
It's not worth it for the hallucinogen qualities.
You'd have to grind up so much.
It takes a lot of nutmeg to reach that, yes.
And for me, it's all about losing control, and I just don't want to lose control like that. So I would find another avenue if that was the case, but I don't want to do that either. So
yeah,
there you go.
It's just, yeah.
So they're about equal. Have respect for the plant. Don't abuse it. Yeah. That's all.
And if you want to read the article, we'll have a link on the show notes.
Yep, there will be a link to it.
And I think, can we do a link to the Patriot Act show? It probably has a website.
Probably has a way to share it on Netflix.com. I'm sure there's a way to share that.
If I can't get an easy link to it, then I will at least put the name of it on there. So if you want to look it up, you guys can.
Yeah. I don't know, and I don't think
there's nothing
on YouTube.
It probably has its own website, I bet, because a lot of
those shows do. But again, it's a Netflix thing, so it's hard to say what they allow, what they don't allow.
Yeah.
So, but who knows? I'm sure if we went to patriotact.com, we might find it. But anyway, we'll see what we can find and put that in the show notes.
Yeah.
All right. One thing I forgot to mention at the beginning of the show is that you'll notice as the show went on that Sue was in the interview. Mm-hmm. And again, just letting everyone know that Sue is now
she's in transition.
Yeah, and she's in the integrated herbalist. That's where she's at, and she's working on making that more about. Well, she's more of an integrated herbalist in general, and that's where her strengths were going, and that's where she wanted to really pursue. So that's why she didn't hear her on our herb lab. So that's what she's doing. And the other thing that. So that was, I wanted to make sure I covered that because I had in my note, we didn't talk about where Sue was. I didn't want to make people go, well, Sue's here and then she's not here. The other thing, though, in our scope of things is, we always talk about learning and constantly learning about herbs and herbalism and this. And so, Candace, what are you reading this week?
This week I picked up a book by Cammie McBride called The Herbal Kitchen. Yeah. And I've been finding it really quite delightful, actually.
Okay.
She has some wonderful stories in there. She has a large materia medica and recipes that are super easy. Excuse me. That are super easy for even folks who are, don't have access to a great herb shop or an apothecary or something like that. I mean, just average folks. She's talking about what everybody in our country could be using this book.
Really? So more of a practical approach?
Yes. I would say, based on I'm about halfway through it, and based on what I've been reading so far, I would say The Herbal Kitchen is the perfect book to get young families and people who are starting out or interested in improving their herbal skills. It would also work really, really well for folks who are... A lot of times when we hit about middle age, which is, yes, about where I'm at, we start to rethink the whole health things that we've been doing. Because when we were younger, we did a bunch of stuff, or we didn't do a bunch of stuff to take care of ourselves. And by middle age, we're noting that changes are happening. And not all those changes are great, like the aching in the knee, or, the fact that you get indigestion now if you drink tea anytime after noon, or other weird symptoms. And so many of us start to rethink what we've been doing, how we've been doing it, and we're looking for better, practical, easy, daily types of solutions. Not something big and dramatic and a bunch of pills, but what can you do every day? The Herbal Kitchen will give you a really wonderful and fun way to start exploring further uses of herbs to take care of yourself, but also make it fun.
Right.
So... yeah, that's what I'm getting from it so far. We'll see.
We'll have a link to that as well in the notes, so you could look at that book as well if you're interested. So as always, we are on Stitcher, and we're on iTunes, and we are available on Spotify and YouTube. If you have a chance, give us a review. We'd appreciate it. Again, this show is made possible by the support from the Herbal Nerd Society. If you're willing, or if you want to join and join the group of people that helps us make this podcast possible, thepracticalherbalist.com. You can click on the Join tab up in the upper menu and read a little bit more about it and what that entails. We'd appreciate it. And as always,
put an herb on it.
The statements made about herbs and products on this podcast have not been evaluated by the United States Food and Drug Administration, FDA. They're not intended to diagnose, treat, cure, or prevent disease. All information provided on this podcast or any affiliated websites is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professional. You should not use the information on this podcast and its affiliated websites for a diagnosis or treatment of any health problem. Always consult with a healthcare professional before starting any new vitamins, supplements, diet, or exercise program before taking any medication, or if you have or suspect you might have a health problem. Any testimonials, questions, or case studies are based on individual results and do not constitute a guarantee that you will achieve the same results.